Uh, it's really a pleasure to be here. And when Dr. Hari said that you need to be here on talking more on the basic process and how insurance works. So, what is our role here? I'm basically from United India Insurance. I'm a regional manager heading the Kochi region. We also have all 4 PSUs with us, and as you all know, we are the largest networks in the world, and the TPAs are here because we are here. So we are the largest insurers, and we provide them, we select the TPAs, and the network is all built based on that. So we have made ourselves very strong to be there in the health sector, so that we provide both cashless as well as reimbursement for all the patients. This is number one. Number two, coming to TPAs, how they are this, we enter, let me go on the process. So what happens is, before selecting a TPA, we all 4 PSUs, National, New India, and United India, and Oriental Insurance. So right now I have a doctor with me, and Dr. Purnima, who is from National, and Mr. Sunil John from United India is a manager. The team, all of us sits, and we have a city committee. The city committee sits together, and we all work on the rates of the what is the package rate. Like for example, the cataract operation can cost around 35,000 for a normal small hospital. Something it can go up to 50 or 1 lakh. So the rates are not uniform. So what, as a public sector, what do we do is, the health sector has to be to reach to everyone. It has to be affordable, and it has to be cost effective, and we also have to control claims. So as an effective measure, what do we do is, we sit across, there is a city committee, then there is a regional committee, and then finally we come to the claims committee at the HO level. So all of us decide on these factors, and we try to negotiate the rates with the hospitals. So sometimes it doesn't work effectively, but at Kerala region, what we are doing is, we have already approached many of the hospitals, and there have been some negotiations going on. So we have involved some TPAs also. Dr. Sheila is there. She has been providing us all the inputs on what is happening. This is based on the PPN thing. Coming to TPAs, you must be wondering, how are we paying claims? Because the premium is quite high, because as earlier Mr. Medias, the person, the earlier speaker was telling, the rates, the premium has gone up. Why the rates have gone up? Because if you compare 100 people, 12 must not have claimed, but the balance other 82 have claimed. There is a claim under that, and there is an exorbitant claim. So the risk has to be spread evenly. So it's not only the factor of not 12 people amounting, not getting a claim, but the rest of them getting a claim which is not under a uniform rate. So to have a uniform rate, this PPN network is working on that. Apart from that, we also have hospitals. What is our role? Like, we also empanel these hospitals into our sector, so that the hospitals are empaneled, and the TPA's role is, we sign a service level agreement with the TPAs. Not only with Mediasis, we also have Vidal, we also have HATPA, we also have MD India, and Heritage, Paramount, other TPAs, where we sign a service level agreement. What is this service level agreement says is, we enter a contract with them, and there is a TAT for settlement of claim. The TPAs are supposed to go to the hospitals, have a surprise check, look at the type of, if there is a claim, we find out what type of trigger it is. Is it a planned surgery, who have already gone for a surgery who is planned, or it is only an illness suddenly occurring and then they are hospitalized. So that kind, we do these kind of surprise inspection in hand with TPA, so that we control the claims. So this is one of the reasons why the claims have gone up, but there is a trigger which we are trying to control on that. The next point is penetration. Penetration level is, we have penetrated all the nooks and corners of the country. It's not, the private companies are also there, but still we are also there, and we also give an affordable policy with an affordable rate, and it has to reach everyone, has to be taken care of that. If there is a claim, it's a payable claim, it's a liability, and it's a payable claim, and we are there to service the client. So this is how United India works, and all the 4 PSUs works on that. Then apart from that, we also have, there was one question on the premium, why there is a rise in the premium. The rise in the premium is basically, there is an increase, there is an inflation going up, and second thing is because after COVID, there is a lot of patients getting hospitalized, and the hospitalization rate is increased. So naturally the hospitals are also charging that, but we have entered in a PPN, as I said, that PPN thing is already entered, the uniformity is obtained in Bangalore, in Chennai, and all the major cities. Kerala is slowly catching up, and still we will be able to do much negotiation and have a level of affordable rate. Then and the TPAs were telling, suppose for example, if there is a cataract surgery, I was just explaining that the same rates are not uniform in all the hospitals, because the doctors or the hospital charges in a different way. Each hospital, the rates are quite different. So we instruct the TPAs, with the knowledge of the TPS, we tell them to go as per the policy terms and condition. Certain surgeries are there, we try to put a sublimit to it, and then we also do a capping so that the claims are controlled, and so that when the premium comes for the when the renewal comes based on their claims ratio, the loading, and if there are no claims, there are discounts are also allowed. So I think I briefly explained about the process of what an insurance company does, and it's a very simple thing, and we will have a question answer session. You can ask whatever is queries from your side.
Thank you.
Yeah, thank you so much.
Yeah.